Okay, let's get started. I'm assuming you can see me because I'm kind of up in the top there. Um, Welcome to our very first Georgia Medical Director Association Grand Rounds. This is a series that will be on every first Thursday at noon. We will have a Georgia Medical Director um, given a session on whatever's current and whatever we think is pertinent to skilled nursing facilities, and especially medical directors. We hope as this grows that the medical director will be in the facility and watch these with their staff and have some input there, because we want our medical directors to be a lot more involved in the nursing homes. It's demanded by the surveyors. It's demanded by COVID, which really showed us the value of medical directorship when it came to complying and helping to alter the commands that came down from on high from all sorts of government agencies and trying to straighten everything out. So we hope this series will be very beneficial and we'll grow it. We're also planning on providing another series of journal club clinical research that will be able to bring in some of our university fellows and residents and faculty to present what they're doing. And we'll do that on another day, one day a month. So we'll just have a series of webinars. So I'd like to thank Dr. Dave Ringer for volunteering to be our very first presentation on a subject that, yes, everybody is talking about it, but we want to make sure our medical directors really emphasize in their facilities what we need to be doing and give their stature to that. This series is being recorded, and I'll be posting it on the Georgia Medical Directors Association YouTube website, and that way we can uh, allow other shifts to see this and all that. I have enabled your video and your audio for the question and answer session later on. Please mute your video, your audio especially, if you're not talking, so that we don't get any echoes and backgrounds on it. So that's where we are. Dr. Dave Ringer is a graduate of the Medical College of Georgia. He did his residency in Northeast Alabama Regional Medical Center. He's board certified in family medicine. He's a certified medical director. He has several nursing facilities in Georgia and is very well versed in long-term care, but he also has the advantage for us of being a major physician at the Greensboro Hospital, St. Mary's. He's in the ER, so he knows what's coming into the ER, and I think he's chief of staff or some kind of division there. So he can give us the hospital perspective of what's going on too. So I'm going to turn this over to our president of the Georgia Medical Directors Association and let him have control of the screens and all that sort of stuff. And we'll try to make this about 25 minutes or so and leave some time for questions. And that's when you can unmute and do your questions. Dr. Ringer, it's all yours.
I don't need it to be turned over to me because I don't have any slides, but
okay, let's go.
And I wouldn't technically know how to do it anyway. It's my first time ever talking on Zoom in a meeting like this, so bear with me. But I'm so glad we're doing this. I think this is a great thing that Perry came up with, that we, provide service back to the medical directors, because sometimes I know I feel like I'm out in the middle of nowhere with nobody around, making my own decisions. Certainly have more access nowadays. COVID kind of opened up some new access for us. So I think this is great, and I was glad to be asked to start. Of course, our discussion today is flu vaccines. And, it's almost like a big duh. But there's a lot of controversy always about flu vaccines. And I actually was probably one of the ones that used to kind of laugh at them, thinking they weren't that big a deal, because some years they're 9% effective, some years they're 50% effective. You get a little flu, what's the big deal? Hurts a little bit, you ache all over, you get a few days off, you go back to work. Well, of course, as COVID has hit, it's kind of changed a lot of our views. And then you start looking at some of the information that's come out. I was astounded by it. Irony is I've always taken the flu shot, but I've always kind of thought, well, whatever. But after this year, it really, really has stuck in my head, the importance of the flu shot. And then you throw that at the nursing home, and it's even more important, because we found, of course, the frailty, the 65-year-olds are in such risk factors that we don't need to take any chances. This year is especially important because of the COVID. And like Perry said, I work in the emergency room some still, and it is interesting. We're already having flu and COVID come in, and how do you differentiate the two? They're very, very similar. RSV is very similar. So you start seeing all these different ones. We don't know which one is which. Luckily, we're starting to get rapid testing, so we're able to kind of differentiate some, but it does change things. So if you can get the flu vaccine and prevent even a percentage of them, it just is going to help so much. Decrease the confusion, decrease hospitalizations, decrease ICU. We don't need to tie the ICU up with people with the flu when we have a vaccine for it, and it does work. One of the things I saw, of course, in the CDC that I thought was very interesting in 2017-2018 season. For the flu, the shot was only 38% effective. So, of course, your first thought, and I think a lot of people in the community and all go, well, 38%, I mean, why the heck? I can flip a coin and get a better chance than that. But by being 38% effective, it basically prevented 7.1 million illnesses in America. It prevented 3.2 million medical visits to doctors in America, and 8,000 deaths. That's just being 38% effective. So you can say however you want, well, that's not that big a deal, but that's huge. So if it just helps a little bit, it's going to really take the pressure off the emergency rooms, the clinics, and everything else that we don't need pressure on right now. So that alone makes me think, why wouldn't you take the flu shot? I mean, it's just a quick shot. I've already taken mine this year, and believe it or not, it didn't hurt, and you don't get sick from it. I don't care what anybody says, especially the sweet little old folks that said, well, I took the flu shot once and I got sick. You cannot get sick from the new flu shots. These flu shots are not live viruses. They're antigen. They're actually the newest one that we recommend, or the CDC recommends now, for greater than 65 years old, is the quadrivalent, which is 4 times higher dosing. But it will not get them sick. It might make them feel a little tired because of your immune response. It might make a sore arm if somebody doesn't inject it properly. For some reason, when the nurse injects me, it doesn't hurt at all. But when I inject my wife at home, she says it always hurts. So I think there is some skill in injecting. But you know, that's my wife's unfortunate luck. But I think that the numbers just are too strong to say that I don't care how each year it's ineffective. 38% saves that many lives and prevents that many medical visits. That's significant. The next thing I saw that was very interesting about it, which I've practiced for 32 years, and I guess I never really put it all together. But COVID hit and we started seeing a bunch of inflammatory changes, a bunch of clotting issues, heart problems, lung problems, and I never thought about it except COVID. Well, the CDC will tell you immediately that there is a 6-fold increase in MIs 1 week after you get over the flu in the elderly population. 6-fold. I guess what happens is, and maybe this is being a little cavalier, but they get the flu in the nursing home, and then a week or two later they have a heart attack and die, and we just go, oh, they were old and they had a heart attack. The CDC is saying it's directly related to the flu. Also increased DVTs, increased strokes, all significantly increased from 1 to 2 weeks after the flu. I never really knew that. So that really, for our nursing home population, really makes you want to push for a flu shot. The vaccination, it says, has a risk reduction of 15 to 45% for MIs, strokes, TIAs after 1 week after. And they say that's equivalent to stopping smoking, using statin therapies, and using antithrombotic therapies that we use all the time. And that's just one shot instead of taking statins forever is equivalent in risk reduction. So again, we think of the flu as just kind of a nuisance, but there's some significant downstream effects from it that as we all start aging, I think we all should look at it. It's just simple. Like I said earlier to Perry, just take the shot. It will not hurt you. One thing that's interesting is everybody says, oh, like I said earlier, you can get sick from it. I'm allergic to it. Well, very, very few people are actually allergic to the flu shot. Statistically, it's like 1% or less. And they say it's from eggs. Most people, this AMDA had a talk yesterday, and the guy kind of made a funny comment that, people come in and say they're allergic to it, but they eat eggs. I'm allergic to eggs, but they eat eggs every morning. You got to have a significant allergy to eggs before it really makes that big a difference. You're not getting that big. So people need to really be aware of if they're allergic. And then, of course, religious reasons, and that's understandable. But otherwise, it's safe, it's effective. Why wouldn't you do it? I'm really, this sounds kind of funny, excited about this year, though, and to see the statistics come out because of mask wearing. I think Ethica facilities are requiring this. Our hospital has required it for years, but everybody has to have the flu shot unless you have some reason not to, allergy or religious reasons, and then you must wear a mask. On the other hand, because of COVID, everybody is wearing a mask this year, or should be. So I'm really hoping that we're going to see a significant drop. If everybody gets the flu shot and everybody wears a mask, we should really have a significant decrease in the flu this year, and we should see it pretty rapidly. And we need that. We need that positive result. And it would be that easy if we just all have masks and have the flu shot. The last thing that I really wanted to talk about was they talked yesterday about herd immunity, and we've all heard about herd immunity through COVID. I've never really thought about it with the flu vaccine, but CDC says basically if 80% of your population gets the flu vaccine, you create a significant herd immunity within the facility. So if we can push and get 80% of our facility taking the flu vaccine, you're going to significantly impact the whole facility. So I think, as a facility full of frail patients, we really need to push it and try to push everybody to get it. Now, there's always going to be somebody that doesn't want it. says I haven't had them in years and I don't ever want them, that's fine. But if we can push all the employees to get it and most of the patients to get it, you're going to get up towards that 80% and have a significant reduction through herd immunity, which is just that much better, that much stronger for the community at large and the local community. So we really need to push that. Then the last thing is studies have shown, of course, the DONs, the administrators, they need to take that shot. If everybody's looking at their leaders, if the medical director doesn't take the shot, ain't no MA gonna take that shot. They're gonna look at you like, if you ain't taking it, I ain't taking it. I know we've talked about this with the COVID as the new vaccine comes out, and they even brought it up last night in the debates, how, you know, we've got to have confidence and you've got to see the leaders taking the shot before others take it. And the flu vaccine we know is safe, will not harm you. And I think we just really have to push for everybody to take it. And I really strongly recommend the medical directors and us leaders all take charge and take that shot. And I know our hospital actually on your name tag has a little dot saying you took the shot. If you don't have that dot on, in the past you better have a mask on, but now of course everybody has to have a mask, so we're good with that. Couple little side things that need to also, I think, are important right now with the flu vaccine, with the COVID and all that, is Pneumovax. Don't forget the Pneumovax. These patients are very weakened and frail, and I think it's a little complicated. Perry can probably help me with this. They keep changing the rules. The latest rule I saw was greater than 65, everybody needs the Pneumovax 23. The Pneumovax 13 is out there. They usually say you give the Pneumovax 13 and a year later the 23. Now they're saying you can do the 23 on everybody, and maybe a physician recommended the 13. You can do it at the same time as you can do the flu vaccine. So we need to protect these folks and get those vaccines in. That's very safe and very well proven. Last, and this is unrelated to the others, but I just, when I was doing my research, thought it was kind of interesting, the Zostavax, which unfortunately I'm 60 and I haven't taken it yet. I need to go take it because after I read it, it's 90% effective. That's pretty darn good. You can take a shot that's 90% effective and prevent a lot of issues. Our nursing homes, we need to make sure they get Zostavax. There is nothing worse than getting a case of shingles and getting secondary infections. And these folks are really weakened right now. Their immune systems are down, and that's going to be our next great epidemic as you start seeing some shingles popping up everywhere. Would not be pleasant, and I don't want to have it. So with that, I think the most important thing that I got out of all my reading was that the flu is not just the flu. It causes some vascular inflammatory changes that can really cause downstream issues, including strokes, heart attacks, the TIAs, dementia, delirium. I mean, it can really affect our patients. So one little shot prevents a lot of that. We need to really push as medical directors, nurse practitioners, and just the nurses and directors of nursing to get the flu shot, do the flu shot. There's no reason not to. Do we have any questions, or did I scare everybody?
Okay, I'm going to take a point of privilege here, being the moderator.
Go for it.
I think if directors of nursing administrators don't get the shot, they need to be shot. So, you know, it's just unconscionable.
That's from a pharmacist.
Yeah, that's from a pharmacist. Well, that's from a guy who's had a stem cell transplant and then went through every immunization since a baby. They had to reestablish every single thing in my body. And I've had the 2 shots Shingrix also. And so, you know, I'm not adverse to having immunizations at all. One thing about the pneumovax, and that's something we really forget about in the flu season, and now with flu and COVID, is we do need to protect from pneumonia because that's just another disease that we could be preventing and saving lives in our nursing homes. The latest CDC says that you should do Prevnar 13 first and then Pneumovax 23. Those are trade names. The reason being Prevnar makes the Pneumovax response a whole lot better. So you get like 35 different types of pneumonia in that. But it's okay if you got them reversed and depending on what somebody's had in the last few years or so. The important thing is to give them the vaccine if in doubt, and make sure we're starting with it. And you can give it the same time you give the flu vaccine. And I think that's also one of the vaccines that the government looks for nursing homes in the MDS. You know, have they had the flu and have they had the pneumonia vaccine? So we really need to push that. There's a app you can put on your cell phone that'll give you the whole deal about, you know, before 65, after 65. Um, Lauren Adler says that it's called Pneumorex Vax Advisor, and I think Pfizer has one too. But you can, you know, look it up, and if you want something handy dandy on your phone to remind you to do that, that would be great. Okay, I'll shut up now. Anybody else got any comments? All you got to do is unmute.
Let me, one more thing that I forgot to mention, and it came up today at the hospital. When you can take the flu vaccine after COVID, and the recommendation right now is that you need 10 days after, of course, the positive test, and you're off of isolation. Once you're off of isolation, you're free to take the flu vaccine, or 24 hours after your last fever. The key to that was, and we wrestled with it at the hospital, you want to get these folks vaccinated before they leave the hospital, or they kind of get lost in the system again. So I think that's an important part of it. Then the next thing is, as far as I read, you can't get too many flu vaccines. I mean, you don't want to get a bunch, but if somebody accidentally doesn't know if they got one at the hospital and they get back to the nursing home and they're not sure if they didn't get it, it doesn't hurt to get a second vaccine. It's not gonna like get overdosed from them. So you don't have to get too concerned. I was a little bit concerned today when the pharmacist at our hospital was concerned about people on high dose steroids from COVID going home and getting a flu vaccine. And I honestly don't have a great answer for that, except I didn't see that in any of the CDC recommendations, because people will be going home on steroids a lot of times after the hospitalization.
Okay, any other comments or questions? I know that Pam O'Rourke has done a really good flu presentation to the Ethica centers, even had Dr. Warnock introduce it, and it came out really good. So
then why didn't they do this?
Well, because I'd already scheduled you. I'm going to get Dr. Warnock to do one of these on something. I hadn't figured it out yet. But anyway, you just can't talk about it enough. And I just think we need to zero in on our leadership. And the medical directors are the ones that can do that. And this is the purpose of this kind of grand rounds, is to get our medical directors thinking, hey, I need to get this done in my centers.
I agree.
Anybody else? Well, we really appreciate your attendance. Like I said, this is going to be going on to our YouTube channel under Georgia Medical Directors Association. I've tried a test and it worked, so I'll try to get this on as soon as I can, and then I'm gonna get the word out to the full range of nursing homes and medical directors that I've got, and tell them that they can go on to this and see this, and they can get their evening shifts to look at it, their supervisors and all that. So we're going to extend this way beyond just a live presentation. Thank you very much for your attendance, and we'll let you get back to work. Y'all take
Thank
care.
you.
Thank you.
Dave, thanks a bunch.
Thanks.
Thank you, Perry.
Enjoyed it. Thank you all.